What are the current challenges facing the healthcare industry in the Philippines?
Presently, what is encouraging and what is the problem here in the Philippines is the patients have to pay extra money after discharge in the private hospital, especially because all the expenses are not covered by the healthcare facilities and not covered by insurance. Only about 80% of our people are covered by insurance, and the coverage is too small. Our PhilHealth pays us late, about 2 to 6 months delayed for the claims. And of course, as I said earlier, the HMOs are not paying the whole thing. Most of them are only partial. So the government covers all the senior citizens, but the problem is the payment of PhilHealth is only very low.
Is this a challenge in your hospital as well?
Yes, because almost all the hospitals are extending services, free sometimes, but the problem is the PhilHealth doesn't pay on time, and the Department of Health is not giving enough money for government hospitals to be improved in services. So what happened, all the people, or almost one half of the people, go to the private hospitals. And the private hospitals are the ones suffering because of the financial cutback.
So how do you think we can, or in the Philippines, they can tackle this problem?
That's why we are telling our the new Secretary of Health and our new President to give more money to health so that the government hospitals will improve in services, facilities, so that the private hospitals, yes, we are helping, but in the long term or long extent of time, they will be bankrupt, so they will close. And remember, the Philippines is an archipelago. So you have several hospitals, not only one in one city or one province. So what will happen is we lack bed capacity. So some people have to fly from or to ride by boat going to another city. And it takes time. So if it's an emergency, the patients will die. Yeah.
Do you think there are enough hospitals in the Philippines to treat everyone? Because the Philippines is such a big country.
At present, we still lack about 30,000 beds. We have more than 100 million population. We have only 70,000 bed capacity all over the Philippines. So we still need about 30,000 beds that could be spread all over the Philippines so that we will be able to serve the people properly.
What is the percentage private hospitals and government hospitals?
Uh, Almost 60% are private and the 40% are government. And usually the private hospitals are spread in big cities. In the facilities in the islands that are small, usually government hospitals only one or two. And they have limited personnel, limited facilities. So they have to fly to cities. And also nurses do not want to go on duty in the provinces because the pay is lower. That's also our problem. One senator is asking us to pay 25,000, that is in pesos, per month for nurses, but we cannot guarantee that. We cannot care for that because otherwise the hospitals will lose a lot of money. That's the problem in the Philippines. We want to extend all our services, especially our members' private hospital. We have more or less 900 hospitals that are private, that are members of our association. We want to help, but the problem is the PhilHealth or the medical care who are supposed to pay our claims are not doing it properly. They are delayed in payment, so we cannot rotate our money. Yeah.
So are your objectives being met at HMA?
Yes, of course, because most of our attendees are managers, medical directors, owners, and they want to learn more because they know that the speakers of HMA are very good, very intelligent, and they present it properly.
That's great. That's
That's
that's good
why
to
the
hear.
Philippines always the number one sender of delegates in HMA for the last 8 years.
It is true. It is
Yes,
true.
that's why Ashok and Edward always talk to me.
Yeah, even in Vietnam, they are majority.
Yes, no, but we still are. We always know na in case, for example, in Vietnam, they have more. Of course, it's local. But us, is always the number one, foreign delegate.
Yes,
That is an
true. Yeah.
experience already for the last 8 years.
Yeah, it's good
That's why.
that we have
So
Filipinos are following HMA.
we want to invite everybody again for the 2017 in Manila.
That was going to be my next request. Can you say something to invite our delegates to attend
Yeah.
HMA 2016 in the Philippines?
As part of the organizer and also of the host for next year, I want to invite everybody, even those who attended now and those who will attend later on. In 2017, we are arranging a new and not expensive scientific program for HMA next year. And we promise you we will do our best, just like what happened in Cebu. Every delegate is happy. They can eat very well, and we have a lot of tourist spots we can ask them to go. And then I am talking to the newest hotel now, one of the biggest in Asia, so that we can have a good accommodation, good service, and of course, good food.
I'm sure the Filipino healthcare professionals will welcome HMA for sure.
It has been a pleasure hosting and also inviting delegates to HMA. They are very proud of what they got from HMA, even if they pay in dollars.
That's good to hear. Thank you very
Thank you very
much,
much
Dr.
also.
Rustico.